Yesterday I briefed about the pain management by medications. Today I am going to talk about the surgical management regarding pain. This pain, if it is not controlled by medications, then we have to look for the other options. The other options are surgery. If I tell surgery, you all know it is laparoscopy. Laparoscopy was done first as a gold standard for diagnosis. But nowadays, due to scans, CT and MRI, it is declined. So when we do other surgeries, and if we find if there are any scars or any endometriotic lesions, we use energy source and do fulgurations. When we use this, we have to be very careful to see that we do not give a ovarian damage, because the number of eggs will start declining. So as I told you earlier, we do CA-125 and AMH before the surgery. But this doesn't cure the pain. Sometimes when the scars or the lesions is given an energy source, it burns. So the pain will be reduced for a while, but again it can recur. So in the patient with long-standing pain or severe pain, or if there is associated cyst also, we do cystectomy. Remember, we should not drain or do hydrodissection and just leave it, because it can recur very fast. So if there is a cyst, we need to do ovarian cystectomy. And for the pain management, for chronic pelvic pain, who has got discomfort in the lower part of the tummy, we do new procedure called LUNA. That is laparoscopic uterine nerve ablation. Means behind the uterus there are two ligaments called uterosacral ligaments, where the nerve enters into the womb. There in the laparoscopy we separate, and we, through the energy source, we burn these nerves partially, so that the intensity of pain will reduce. And this acts for many years and no need of any medications. And even there is one more operation called presacral neurectomy, where the nerves are in bundles in just above our tailbone, where we open and we just cauterize the nerves. This is called nerve ablation. But there is one complication with presacral nerve ablation, where it can cause constipation or increased urinary urgency. So we customize according to the patient's condition. So tomorrow I will be talking about the medical versus surgical management and surgical management per se. Thank you.